Today I'm talking to Dr. Aarti Bansal, who's a GP in Sheffield, but also the founder of Greener Practices.
Greener practice is really about good clinical practice, because in general practice, the majority of our carbon footprint sits in prescribing. Can we prescribe exercise? Can we prescribe increased social prescribing, particularly prescribing in nature, sometimes called green prescribing, which has multiple additional benefits to health in terms of immune function and inflammatory responses, as well as social connectivity and activity, and doing something with meaning and purpose. So that's definitely something we can do. We can think about where can we reduce waste in our prescribing. Many of us know that patients who are on PRN medication get them dispensed monthly, and we can think about how can we reduce that. We can think about where are the opportunities for low carbon prescribing. So metered dose inhalers are most commonly prescribed in the UK for things like asthma, whereas in large parts of Europe we use dry powdered inhalers, which have an absolute fraction of the impact from a greenhouse gas point of view.
Is there anything we can do in terms of architecture or transport that might help?
Absolutely. So after prescribing, travel, patient travel, and our travel is the next biggest area of our carbon footprint. And I think we can think about what can we do to reduce travel. And COVID-19 has made us all go to remote consultations. Now, remote consultations are not always effective, they're not always desirable, and they may in some situations actually widen health inequalities, but there's a place for them. I think we've all found there's a place for them. Yeah, in terms of buildings, I think we need to think about the biggest area we can think about is where do we get our energy from? And practices can really think about, can we switch to 100% renewable energy providers?
Is there anything that we should really focus on that should sharpen our minds to this issue at the moment?
COVID-19 is a zoonotic infection that has been caused by habitat destruction. And the UN and the WHO have said that these sort of pandemics, these sort of zoonotic diseases are more likely if we don't do something to act on the climate and ecological crisis.
Tell me, where would a GP go to learn a little bit more about how to make their practice greener?
So one of the things that we've done at Greener Practice is create a website specifically with the intention of providing resources for the general practice community to start to take actions that improve the health of patients now and improve the health of all of us in the future. And we have information on there about climate and health, but we also have links to all of the tools that GPs might need to use to make these actions. So one of those tools is an audit called Green Impact Audit for Health, which actually lists the very practical actions that practices can take towards greener practice, and then those practices get rewarded and recognised for the actions that they're taking.
Today I've been talking to Dr. Aarti Bansal, who's a GP in Sheffield and also founder of Greener Practices. Thank you, Aarti.
Thank you, Donald.